It's not just so that we'll feel good and that we'll be around here for a long time and have good health. Others depend upon us. We have children, grandchildren, loved ones that depend, that hope that we're going to be here. And the quality of life that we're going to have depends upon us doing what's right for us. For me, doing what's right and getting proper exercise. And I have 3 grandchildren. I'd like to see them grow up and get married. I'd like to see great-grandchildren. And I'm only going to get a chance to do that if I do what's right for me.
Like many other medical conditions, diabetes is progressive. That is, it develops gradually and can lead to additional health problems or complications over time. However, with proper treatment and self-care, people with diabetes can slow its progression, minimize its impact on their daily life, and reduce the likelihood of complications. Although many medical conditions are managed through medications, 90% of managing diabetes is self-care. Oral medications and insulin alone cannot control glucose levels or prevent complications. A healthy lifestyle, which includes proper nutrition and exercise, along with effective glucose monitoring, are keys to taking control of your diabetes rather than letting it control you. Although scientists are constantly working on new medications or other treatments for diabetes, currently there is no magic bullet, quick fix, or cure for diabetes. However, most people can control their diabetes effectively by following the self-care advice in this program. The goal is to make gradual lifestyle changes. These are long-term changes that can provide many health benefits beyond controlling your diabetes.
Yeah, for the most part it is under control. And that takes, for me, it takes concentration for my glucose level to stay under control. The eating, and I've talked to a nutritionist about portions, eating less more times per day. Trying to never get hungry is what he says. Because when I get hungry, then you want to, overeat.
As can be seen from the diabetes timeline, high glucose levels can be present even before your physician can detect them from your blood work. The timeline also suggests that often people are pre-diabetic, meaning fasting glucose levels are above 100 milligrams per deciliter. If a blood test shows elevated glucose levels after fasting, this is a pretty reliable indication that your body is not clearing excess glucose out of your blood and placing it into your cells where it belongs. The threshold for a diagnosis of diabetes is a blood glucose level of 126 milligrams per deciliter after fasting 8 hours without food or drink, or a non-fasting blood glucose level of 180 milligrams per deciliter or higher. Diabetes is a progressive condition and there is no cure. In fact, there is a strong belief that many of the cells that make insulin, the beta cells, may already be ineffective when you are first diagnosed. Start today and follow along with the recommendations made in this video and put into action simple changes in your life to slow the progression of diabetes and reduce risk factors for complications. Which brings us to another important point. Your attitude towards diabetes shouldn't be to resist medications or insulin, but to do whatever it takes to achieve tight glucose control. It's important for you to know that even if you have to go on medication, if you don't eat healthier and be more active if able, you're allowing the condition to progress faster than it needs to and not maximizing the benefits of the medical treatments. The good news is that the changes you have to make are less difficult than you believe, and you can make these changes. Think of this DVD as a coach. It's here to remind you about the things you need to work on and why it's important for you to make certain changes in your lifestyle. Why should you care about making long-term lifestyle changes that will help you manage your diabetes? Let's take a look at some of the problems that can result from diabetes. These aren't inevitable. They don't happen to everyone with diabetes, but your chance of experiencing some of these complications are significantly reduced if you implement healthier behaviors. Now the bad news. Although this DVD is intended to help you reduce the risk of these complications, you need to be more aware of the potential for developing these complications, which could seriously impact your health. People with diabetes are 2 to 4 times more likely to have a heart attack or a stroke than non-diabetics. High glucose levels increase arteriosclerosis, often called hardening of the arteries. We also know that almost 3/4 of people with diabetes have hypertension or high blood pressure. High glucose levels also interfere with blood circulation, reducing the proper delivery of nutrients to small blood vessels. Poor circulation is complicated by nerve damage or neuropathy. As many as 60 to 70% of people with diabetes experience nerve damage, and severe nerve damage is a major cause of amputations. 60% of new cases of amputations below the knee are people with diabetes. Diabetes is a leading cause of blindness from a condition called retinopathy. Between 12,000 and 24,000 new cases of blindness are caused by diabetes every year. Diabetes is a leading cause of kidney failure or nephropathy, accounting for 43% of new cases every year. Periodontal or gum diseases are more common among people with diabetes. Among young adults, those with diabetes are often at twice the risk for periodontal disease, and almost 1/3 of all people with diabetes have severe periodontal diseases.
There's two major reasons why patients with diabetes should be concerned about their oral care. Those with diabetes, particularly if they're not under good control, diabetic control, end up having more severe periodontal disease, and it occurs at a younger age. Secondly, if they have diabetes and they have gum disease, they end up having more difficulty in maintaining control.
For women with diabetes who are pregnant or planning to become pregnant, there are important reasons to make sure their diabetes is under control. Research has shown that poorly controlled diabetes before conception and during the first trimester of pregnancy can cause major birth defects in 5 to 10% of pregnancies and spontaneous abortions in 15 to 20% of pregnancies. Also, poorly controlled diabetes during the second and third trimesters of pregnancy can result in excessively large babies, posing a risk to the mother and the child. In general, people with diabetes are more susceptible to other illnesses and, once they acquire these illnesses, often have worse prognoses or outcomes than people without diabetes. For example, they are more likely to die with pneumonia or influenza than people who do not have diabetes. Uncontrolled diabetes often leads to biochemical imbalances that can cause sudden and dangerous life-threatening events, such as diabetic ketoacidosis and hyperosmolar non-ketotic coma. Although these conditions do not happen often, a general recommendation is to call your physician if your glucose levels are continually over 250 milligrams per deciliter, as this can lead to a coma. Check blood glucose levels often, more when you're not feeling well, and don't hesitate to call your doctor if you suspect a problem. Although the medical complications of diabetes are serious, your risk of experiencing these can be greatly reduced if you're able to manage your diabetes effectively. Extensive studies have shown that management of diabetes, including tight glucose control, can reduce retinopathy by 76%, neuropathy by 60%, and nephropathy or kidney failure by 56%. The key is self-care. As we said earlier, 90% of managing diabetes is self-care, whether you are taking medications or not. The progress of your diabetes is largely under your control, and you can reduce your risk for complications.